Journal of Healthcare, Science, and the Humanities. Call for papers, special issue. HIV and health disparities. In the Black community. The continuing HIV epidemic in the Black population has resulted in the disproportionate burden of morbidity and mortality in the Black community. The HIV epidemic, now coupled with the coronavirus pandemic, further exacerbates the burden of disease, disability, suffering and premature death among Black people throughout the U.S. Excess deaths refer to the age/gender-adjusted death rates of the Black population compared to the age/gender-adjusted death rates of their non-Hispanic white counterparts. The 1985 U.S. Department of Health and Human Services report of the Secretary's Task Force on Black and Minority Health, commonly known as the Heckler Report, reported 60,000 excess deaths among Black people in the United States. This landmark report marked the first time the United States government had comprehensively studied the health status of racial and ethnic minority populations. The report led to the creation of the Department of Health and Human Services, Office of Minority Health in 1986. Soon after, offices of minority health were established in other DHHS operating divisions and in several state health departments across the country. In the 1985 report, there were 6 causes of excess deaths including heart disease and stroke, cancer, cirrhosis, diabetes, unintentional and intentional injuries, infant mortality. In 1992, HIV/AIDS became the 7th leading cause of excess deaths in the Black population. By 2005, the 60,000 excess deaths had risen to 83,000. In 2018, Black people represented 42% of new HIV diagnoses, 41% of all people living with HIV, and 42% of HIV-related deaths. Despite comprising only 13% of the U.S. population. These disparities are even more pronounced when you examine data on subpopulations within the Black community, including gay and bisexual men, transgender individuals, rural populations, and Black women. Underlying and driving these inequalities are systemic factors including, but not limited to, poverty, access to affordable health care, access to stable housing and transportation, medical mistrust, racism, homophobia, incarceration, stigma, discrimination. In 2020, racial and ethnic health disparities were heightened by historic, as well as continuing, system inequities such as economic injustice, criminal justice, disproportionate Black incarceration, environmental injustice, food insecurities, and so forth. These inequities directly and indirectly adversely affect vulnerable populations in all geographic regions in the U.S. In addition, systemic racism harms all segments of the U.S., but disproportionately, burdens people of color, regardless of income or educational level. Moreover, the continuing HIV epidemic and the coronavirus pandemic have an exponential adverse impact on the Black population. In August, CDC reported that compared to non-Hispanic white persons, the rate of COVID-19 cases was 2.6 times higher for Black or African American persons. The rate of COVID-19 related hospitalizations was 4.7 times higher. And the rate of COVID-19 related deaths was 2.1 times higher. Current HIV risk factors and health challenges for African Americans, Hispanics/Latinx, Native Americans/Alaska Natives, selected Asian Americans and non-Hispanic white people are different. Thus, the solutions may overlap, but the differences may demand a unique set of recommendations and public policies. We expect this special issue to address the diverging challenges, if any, of HIV in the Black community and to present national, regional, state, and local public policy recommendations to meaningfully address HIV in the Black community. To find out more, email us, call us or refer to the links in the description box.